I'm Jon Dadon. I am the Chief Revenue Officer here at MedResults, and essentially I am responsible for our account management team. Without further ado, I'd like to introduce Dr. Croley and Arash Kalantari.
Thanks so much, Jon. I'm excited to be here with you guys. Hi, Arash. I appreciate any opportunity I have to talk about the Plexer technology. I've loved working with you and love using the device. So I'm happy to share my experience with it.
Today's basically lecture is very interesting, and it is based on Dr. Crow's recent research on new indications and protocols. So I'm excited to know more about it myself.
Yeah, so a lot of these, protocols were developed in conjunction with you, Arash. I mean, obviously, you've been using this technology and kind of a pioneer in this field and bringing it into the U.S. for a while now. And, the things we're going to talk about, many of the people who are on this webinar and are logging in or going to be watching it virtually are students that know that I'm fairly reluctant to bring things into my practice, and including this. So I think I met you several times and I was like, yeah, I'm not so sure about this. And, I had the pleasure of you treating me, which is also a rare event for me to receive any treatment, but you did this shower and with some of the products we're going to talk about in the class today. And I was blown away with the results. And so really had great personal results, but then it's like, can this translate to what we're seeing in our patients? And can we actually take this and apply it to a large population of patients of various ages, various stages of life, various health conditions, and get consistently good and reliable results? And in fact, we've been able to do so. There are some, things that I've been doing to really kind of try to improve what I learned from you, and to talk to you about this, how we can really work together more to develop these protocols. So for new providers who are bringing this into their practice, or for people who have already decided to get on board and, be a Plexer provider, a Plexer practitioner, that we can help them develop these protocols or use these protocols in their practice to really get some of these phenomenal before and after results that we're all seeing across the board with the Plexer device. So the three that we're going to talk about today, you'll see on this slide here, and really the protocols and techniques that we can use with this device are kind of endless. So we picked three that we use quite often in our practice. But as Arash and I talked before the call, it was hard to narrow it down to three, because it's like we really can go on and on about how many different areas of the body and the face that we can treat with this, and the different protocols that we can use. But the three I think that are pretty popular and that I kind of want to focus on today, and Arash or any of you guys that are on here that have questions, feel free to ask about other things and other protocols, and we'll share that. But I think these are three pretty popular ones that many people can bring into an aesthetic practice and implement right away with basically minimal or very little downtime and great patient results. And we're going to show you some of those photos today. The first one we're going to talk about is the glass lift by Plexer shower. And I would say that this is, one of the more common procedures that once you start implementing this in your area and performing, that people are going to request. The other is going to be a treatment that you can use for puffy eyes or bags under the eyes that we can use, kind of doing a soft surgery with the Plexer blepharoplasty. And then the third one we'll talk about today is a neck lift by using a Plexer cat resurfacing. And, any of you who have been in this space long enough know that necks are a challenge to deal with, and we all kind of struggle with necks. And so I think this is a great device with gives you a solution to that for your patients who don't want to undergo a surgical neck lift. Some of the things that we're going to talk about as we go into the glass lift, we're going to go over the actual device itself. How does it work? How can we use this device to get these outstanding results? So the technology behind it, how it works, how we're going to be using our neurotoxins in this treatment, and how we're combining it with other products such as ActoFeel or Acto Reverse. And these, we're going to tell you exactly what those products are and why they're working. We're going to talk about vectors. So vectors, I don't think we really think about this often. It's something that we talk about extensively when we're doing things like PDO thread lift training. But actually, this is going to be extremely important when we're using a lot of our energy-based technologies as well. but specifically when we're doing our plexor procedures, because we're using this device to create these vectors and create an actual lift. So it's more than just a rejuvenating treatment. We're actually performing a lift. And by performing these lifts is how you're going to be able to charge the prices that's going to give you the best return on your investment in your practice. We'll go over some soft surgery indications and how you can really implement this in a variety of settings, and then how we're going to, of course, let you know how you can get the device and bring it into your practice. So with the plexor, you're going to see that you're going to have more results with very little or no downtime. And I think that is the key. Now, we don't say zero downtime with everything that we do. So as we get into some of the more ablative portions of the plexor, there is a little bit of social downtime. So it's not any major healing, but the patients may not want to go out for a period of time afterwards, or we have some products that we can recommend that they can help cover up the little marks that they'll have, but it's still minimal and it's no real pain during the recovery process. So it's really, no downtime, but a little bit of social downtime with the more aggressive treatments, but literally zero with our our plexor shower. Now, this patient that's coming up here is a patient that was seen and treated at my practice, and she was actually one of the first patients that we treated. She was new to the practice, and we had she was going to come in and have some things done, but we'd advertised for models. And she said, I'll try that procedure. But this individual had no prior aesthetic treatments, and so this was kind of first time patient, first time into
Virgin
this.
skin.
What's that?
I said like a virgin skin.
Yeah, virgin skin. So yeah, it was kind of the first thing that she was going to get. And so I was actually doing a training with one of our estheticians the day that she came in. And so she was one of the patients that I conducted the training, and the esthetician actually did the treatment. And we'll see, we did the plexor shower on her with the glass lift. So she had a couple of treatments. That's going to be the result after her second treatment, 1 month after her second treatment. And she was blown away with it. So of course, she's one of our biggest advocates now. And all of you guys can look at that picture and see why, especially when we look at them side by side. And so, she sent in the second one, but her family noticed the difference. She noticed the difference. It was quite impressive after two. The second one, we did do the glass lift. The first one was just a plexor shower with the H8 serum with the CD44 signaling molecule in there. So the Actiferm that we're going to talk about. Okay. And so with the glass lift, let's just talk of what it is. So it's a name that you can use in your practice, or you can come up with your own if you want to use it. But you're going to see basically refined skin. You're going to have a better glow to it. You're going to have diminished pore size, help some with pigment. And it's a treatment that we use a plexor shower. So this is the plexor device using what we call the shower tip, which you'll see is kind of shaped like a clothes hanger, essentially. So it spreads the energy out over a kind of a wider area. So we're not delivering really discrete little tiny pinpoints of plasma. We're spreading it out over this bar. And then we're combining that. So this is going to create micro channels that open up, and then we can deliver a topical product into those channels. And in this case, we're using a product called Acto Reverse, which is an hyaluronic acid serum with a CD44 activator in there to stimulate collagen long time. And we're combining it with our neurotoxin. And so we're mixing neurotoxin into the vial, and then we're putting this on topically. So I think many of you may be familiar with that if you're doing any kind of microneedling with Botox. So, kind of one of the common ones that I get asked about a lot in classes is going to be the aqua gold treatment, or something very similar where we're using a microchanneling device and mixing in our HA serum and our neurotoxin, and we're stamping it in the face. So this procedure that I'm talking about, I'm going to the results you saw and the technology that we're going to tell you how to get those results. I'm going to tell you is something that I find superior to that older technique, older way of delivering that with a microchanneling. So, Arash, are you going to talk about this at this point, or do you want me to go on?
I can go ahead and talk about.
Okay.
Yeah. So we decided to basically define every part of this glass lift technology. So for you guys, it's more easier to basically understand it and also apply it. Thank you, Dr. Croley, for your amazing basically experiences and words about plexor. So plexor is a plasma generator, and I want to introduce the nano-ablative. Usually, The first thing is understanding what is the technology. So Plexer generates plasma, and plasma is not an energy, is not like a laser or radio frequency. Plasma is the state of matter. Like we have solid, we have liquid, we have gas, and we have plasma. So planet Earth is in the shape of solid, while sun is in the form of plasma. So imagine you make a small little sun on top of the skin. So just like the sun, the plasma that you generate is basically holding high temperature. The temperature of the plasma that basically Plexer makes is about 20,000 Celsius. And still we call it cold plasma. And these basically little bolt of plasma, when it touches the skin, it will sublimate the skin. Sublimation means turning the solid directly to gas. So imagine you have a log and you use other technology, you use laser, for example, and what happens that you burn the log, you're going to end up having the charcoal. It means that other energy-based devices, they burn your tissue and then you end up having the necrotic tissue or coagulated tissue. With Plexer, because you are using high temperature, so you sublimate the tissue, means the whole tissue will turn to gas and then you don't have it anymore. So the whole tissue is gone. Now, one of the main specifications about Plexer is that we generate clean or pure plasma. It means that this plasma is not mixed with any other shape or form of energy. So we are not using any sort of high current electricity or radio frequency. Both of those energies, they penetrate deep in the skin. Therefore, your heat and your energy will basically go and cause some deep thermal damage. If you look at this picture here at the right side of the screen, you see that energy goes inside. So you have ablation, you have necrotic tissue, and then you have thermal damage tissue. For your skin, it is very difficult to pass the thermal damage and then heals the necrotic tissue and then go and basically feel and recover the ablated tissue. That's why in some cases, your healing time takes for a long time. And then the longer your healing takes, the more you are basically getting side effects and the risk of pigmentation, the risk of keloid and things like that. When we use Plexer, the whole energy is outside of the skin. So you are basically removing, it's like you are shaving the skin from the top using plasma knife. And that's the basically cool thing about technology. Now, the nano-ablative plasma is using a very small and tiny little of plasma bolts. So instead of making a big bolt of plasma, you are generating in a small, millions of small plasma bolts, nanoplasma bolts. And we use, as Dr. Croley said, we use a triangle tip and we basically move that tip over the skin. So we make nano, basically plasma bolts. Therefore, we make micro holes. As you can see in this picture. One of the good things about Plexer is that the hand pieces are hands-free, so there's no cable in this new generation of Plexer, and you can use it everywhere in the room. So step 2, because you made lots of micro holes in the skin, now you can use these micro holes to feed your skin. Unlike microneedling, there is no bleeding, there is no eczema. So your skin is just like a sponge absorbing and sucking everything in. And this is a very good advantage of this technology, which basically activates your absorption and accelerate the absorption. Okay, the second part of the basically this Glassif protocol is Actofuel. I want Dr. Croley to talk about this part more, and I can join.
Okay, yeah. So Actofuel is a product that's a hyaluronic acid serum that's not cross-linked, and I've used a lot of hyaluronic acid serums over the years, actually. And many of you that are doing microneedling may have your own preference on what you have used for this in the past, especially if you're using a non-cross-linked. I get asked the question often, what is some of the differences? Why would I use one versus the other? When we cross-link our hyaluronic acids like we do in our fillers, a lot of that process is to give us longevity. So it's going to stay in the place that we put it for the filler. When we're using it for a regenerating treatment or a stimulating treatment with our plexus shower, or like many of you guys have used in the past with your microneedling, we're really using this for a rejuvenating treatment. So we're really wanting to hydrate and plump the skin. And in this case, what I found in this product and why I like it, and I've actually, even before I got the plexer, I had tried this and used it with our microneedling because we have such great results. It has the CD44 signaling molecule in it. So what does that do? And many of you saying, why do we put that in there? What is the purpose of that? And that is to stimulate the fibroblasts. So we have long-term collagen production and elastin production. And in the aesthetic space, I think it's most of you probably are aware or know that we are moving towards more biostimulant treatments. And so in the past, we were looking at a lot of, treatments that really weren't dependent on the patient's ability to make collagen and elastin. We were using, fillers and gels that we can inject, and we would fill up a hollow spot regardless of that patient's underlying health or medical condition. And we could create some sort of abnormal shapes and abnormal results. And if you didn't go to a provider with a really artistic eye or with experience, that's where we would get some of these odd looks. For a while, it was a little bit trendy. Patients wanted people to know they had work done, so they liked these really exaggerated abnormal results. But in general, we are seeing a trend away from that. So it's not that those, gel fillers have no place or they've lost their place in this market. But what we know is that in general, we're moving more towards biorejuvenative techniques. So we're using the patient's ability to make collagen and elastin to their own advantage, to give them a more natural result, to give them a longer lasting result. And what we're seeing is it's more than just filling a hollow space. So they're getting an overall glow to their skin, tightness to their skin. They say that they look more vibrant. So we're getting tightening, lifting, and volumizing all from these biorejuvenative techniques. And any of you who have been to a lot of the major conferences over the last, year or two really know that the talks are moving in that direction. And so we had a big Empire event in Miami in December, and that whole point of a lot of that conference, we had people who were talking about their techniques for biostimulation. So this product, ActoFeel, is an HA, as a hyaluronic acid product, but really the key to this and what sets it apart from the other topical hyaluronic acids that you're going to buy over the counter or order online to use in your treatments is that we have this CD44 receptor activator. And I want you guys to remember that, and I want you to understand the importance of this, because this is what is going to change this from a normal hyaluronic acid topical product to a product that's going to help give you biostimulation, because it's going to stimulate the fibroblast, which is going to be what makes your collagen and elastin. So that is where we're seeing these results 3 and 6 months down the road. So remember, if we don't cross-link our hyaluronic acids like we're doing in a gel filler, a lot of them are going to go in, they're going to moisturize, our body makes it and breaks this product down in a 24 to 48 hour cycle. So it kind of goes away quickly. But this is a little different because we're putting a signaling molecule in there that's going to say, hey, let's go turn on this fibroblast. So we're going to make collagen and elastin over the next period of months. And so we now change this from something that's going to be a treatment that the patient's going to have to get every few weeks to maintain the results, or once every 3 to 4 weeks, our daily hyaluronic acid, which they can use. I mean, it's also good for that, but we're turning it more into a treatment that's going to be rejuvenating, biostimulant, and it's going to last for months. And it's because of this special CD44 receptor activator that is included in this product. So I think this is a key to the treatment. I think, you can combine it with a lot of other things. It is going to help any topical agent, any kind of skincare product line that you have. It will help that absorb by creating these micro channels. So it's not that you can't do that, but if you really want the results that we're talking about today, and that we're going to be advertising to our patients when we say a glass lift, and we're going to tell them that they don't have to get this as often as other treatments, key to that is going to be using something that is going to be biostimulation. And in this case, I use the ActoFeel, which has the CD44 stimulator in it. Arash, do you have something you want to add on that?
So the interesting thing is, with Actofil, when we designed these basically products and in these brands, we designed it with a cooperation with a lab in Italy, and you know that they are very good at basically this kind of stuff and nanotechnology. So the whole concept was to start talking to your fibroblast cells instead of like burning them, right? So the whole industry, as we know it right now, it's about basically, if your fibroblast is not making enough collagen, so let's use any energy-based device to burn it down, and then your skin has to create new fibroblasts and basically start the granulation. Now, with this different concept, as you were basically talking about, the new concept is instead of basically burning your fibroblasts, instead of being aggressive, instead of injecting like cross-linked stuff, so you use the nature of your body to rejuvenate. Basically, if you cut your hand, you don't need anything. Your body will recover and heal itself. So that power, that healing power exists in all of the people, every human. So if we learn how to use that for skin rejuvenation, then we can make miracles. What happens is by aging, we basically break down our collagens. So we end up having fragmented collagens, which they are like monomers of basic amino acids, right? So those monomers, when they exist in the tissue, they are useless. So for our skin and our body, fragmented collagen is a trash. So they have to get rid of it. There is a specific enzyme which comes to the play and dissolves that fragmented collagen. And then when that enzyme shows up in the tissue, that enzyme activates the CD44 receptor. Now, with basically sending this fragmented hyaluronic acid, which is basically Actofil, we are creating the same basically monomers in the skin. So this is the same thing that the same enzyme has to come and dissolve it. So when you apply Actoferm or Actoreverse, the same enzyme will show up. Therefore, the CD44 receptor get activated. So for your fibroblast cell, it is a signal for like an intense aging. Therefore, they start to activating collagen production genes. Therefore, you have rejuvenation, volumizing, and lifting effect. Now, to have that basically collagen production, they need raw material, which is amino acids. In the Actoreverse and Actoferm, we also have all the necessary amino acids that your fibroblast cell needs for collagen production. And if you see this basically diagram, you have amino acid, you have the fragmented hyaluronic acid, you activate the genes, and then using this amino acid, the fibroblast generates collagen, and that's how it works. So we have two types of product. One is Actoferm. It is a box of 3 vials. Each vial is 9 ml. And then the other one is Actoreverse, which is 3 vials of 5 ml. And both of these products, they have CD44 activator, and also amino acids. Actoreverse also has basically glutathione and vitamin C. So it works for brightening, whitening, and works on melasma, pigmentation, skin discoloration, so on and so forth.
Yeah.
So you can use Actofil as a topical. You can use it with Plexer. You can use it with microneedling. You can use it after fractional radiofrequency, like Morpheus, for example, or Vivace. You can use it after any fractional laser. It helps for healing. It promotes better result in volumizes your skin. It also, outside of US, it's a class 3 medical device. So all of our doctors in South America or Europe, they inject it. And also you can use that as a pinpoint injection or tunneling injection, but not for US. US, we use it as topical.
Yeah. And can you go back to that one just to let me clear? Because it confused me for a little bit. So I know that maybe we have a lot of people on here tonight, so I'm sure they have some of those things. So we talk about Actofil, Actoferm, and Actoreverse. So Actofil, correct me if I'm wrong, Arash, but the way I finally wrap my head around Actofil is kind of like the big picture kind of thing, right? That's
Yeah.
the
It's a
company, the
brand name.
brand. And then in the Actofil line, you have two products, Acto Firm and Acto Reverse. And so
Yes.
if you see us use these terms, we're not talking about three different products. Actofil is kind of like the big brand, and then Acto Reverse and Acto Firm are the two products within that brand that we're going to use to get the results that we talk about. Reverse has the lightening agents in it, the glutathione, the vitamin C to help with our skin brightening, our skin lightening, and the other is more just for volumizing, lifting. They both do that. They both do the volumizing, lifting, and tightening, but the Reverse actually also has, in addition to that, the glutathione and vitamin C for skin brightening and pigment changes.
Exactly. And they have different pH, and because of that, they activate more. We also are launching our Actosome, which is our exosome. And this is the new way of looking at exosome, which is the combination, because exosome basically is just a messenger. We have a messenger and also the message in our new product. So more products are coming. I mean, my
Maybe we'll
goal.
do a webinar on that, Arash. I didn't even know you had that one coming. I'm excited about exosomes. I'm hearing for the first time.
Of course. You know, with Actofil brand, my goal is to basically develop an alphabet that you can really using those alphabet to talk to your fibroblast. That's the goal. So ActoReverse and ActoFirm, they are the first two alphabet, and then we have two more which is coming. One is for a scalp, and the other one is for body and face. So we'll talk about that in 2 months, probably.
Yeah, there you go. Excellent. I look forward to that one. So.
Yeah.
So again, we have all these different application methods that Arash just went over. And just to point out, like outside of the US, it is used in injection. So it is provided to you in a sterile vial. But in the US, this is topical application only.
Exactly.
Okay. So in addition to using the Acto Firm or the Acto Reverse, or in combination of those for the glass lift, we're also combining this with our neurotoxin. And so depending on which brand you have in your practice, this is going to be your Botox, your ZMN, Dysport, Jeuveau. I mean, whatever your flavor of the day is, you're going to combine your neurotoxin with one of these products for topical application. Now, there's a lot of talk around this, and this has been used for a long time in these more superficial layers. So we know that when we do more of our more superficial or intradermal injections of our neurotoxin, the idea is that we're going to get reduced pore size. We're going to get more of a kind of a tight skin. It's going to look like, you put kind of saran wrap over it, or dolphin skin or glass skin. Those are all different terms that people have used to describe this. We also kind of get decreased oil production. So some places, parts of the skin that are really prone to oiliness or outbreaks, you'll know that we've injected those areas with little tiny microdoses of neurotoxin for a long time. Well, because we saw these results, the thought was, can we use a dose spread out topically over a large surface area? And we don't impact the muscles in that area. So we're not really causing any kind of muscle relaxation or paralysis. And so we're not going to get some of the side effects that we would see in some of the higher risk areas, but we're going to get a lot of the more, beneficial things that we would see from the skin. And so there have been a lot of studies around this, because there's a lot of our immune cells in the skin. And if we expose them to neurotoxin, is there, some chance of resistance and things? Those are some concerns that are out there, because it's a little bit more immune stimulating than what's in the muscle. But my point here is that this is not a brand new technique. This has been tried and true for a very long time, and people have used it in this manner for a long time. What is new about this is the way that we're applying the product. So we're applying it in a manner that we're not having to actually use needles. We're creating these micro channels with the plexor shower device, and then we're able to apply the product and have it absorb in these channels and see really phenomenal results. I mean, the results in my hands and my practice are actually better. I was going to say equal to, but actually better than what we see when we do these in a microtox injection technique, where we literally take our neurotoxin and inject small little doses manually with the needle. We're seeing better results. And I think that's because we are combining it with this product that's going to signal the fibroblast. So we're getting kind of our short-term results. That's going to be our immediate tightening and lifting that you're going to see probably from the plasma itself. And then we're getting our long-term results from the collagen stimulation from stimulating those fibroblasts. And so how do we mix it? I mean, I guess this is going to be the technique or the protocol. So for those of you who have it already, if you don't have this, this is a good slide to take a picture of, to write down, to contact Arash or one of us, and we'll go over it with you. But you're going to take your product, your Acto Reverse, and because that is going to be more of a biostimulant, a bit stronger, if you will, and give us more of the brightening, then we're going to see with the Actofirm, that's the product that we use for this. And we're going to mix our toxin in. Now, when we started doing this, we were using 20 units of our neurotoxin into that vial. And I did that for a while. I did find that I had better results with 40 units. So obviously it does add a bit of your cost to the, the provider cost to this procedure, but you're marking this up high enough that you have a great ROI, and you really want your patients to have the results like we're showing you these photos. And so you want to make sure that you're kind of using that right dose. We're giving you a dose range here. I will tell you that I tend to use the higher end of this range. I use 40 units equivalent of Botox. I use Dysport in my practice, so I use essentially 100 units of Dysport into this vial. But you're going to use around 40 units of Botox equivalent if you want to get some of the results we're talking about. If you're really wanting to play around with this and kind of customize it some, we're going to give you some treatment protocols for different age ranges. And what you'll find is your younger patients, you might be able to get by some with a slightly lower dose and still have a nice glow to their skin, but it may not last as long. So I just use 40 units or 100 units of Dysport for all of mine. You're going to mix that into your vial. So your 5 milliliters of your Acto Reverse, and then your Actofirm, you're actually going to send home with the patient to apply at home after the treatment. And you're going to send 2 cc's with that. So we're going to take our Botox, our equivalent, mix it into our Acto Reverse, and then that vial will be used to treat multiple patients. So we don't need to, this is not one whole entire Acto Reverse for one single patient. We're going to typically get maybe, 3 patients out of a vial.
Yeah, absolutely.
So the protocol, you'll see we've divided into age ranges. And the one thing that, we talked about before the call, and we kind of debated changing this slide a little bit, is, I want to be clear that there's no downside. You can, I shouldn't say there's a slight possibility with immune stimulation. Maybe you worry some about resistance if you do this very frequently, like monthly. That might be a little bit of a problem if you're doing it too frequently with a high dose of neurotoxin. Theoretically, maybe you're going to have some immune stimulation with that. I don't worry about it a ton, but it's there. But the idea is that if somebody loves the result, it's going to continue getting better. But if they have an event coming up, say in 3 months, and they love it, there's no reason you can't go ahead and repeat that. But in general, we see that younger patients are going to be more prone to produce more collagen. And so we see this with any of our biostimulant treatments. So we don't tend to need to do as many. They'll get a more exaggerated result from one of our biostimulant treatments compared to what we would do in an older patient. So you see in the 25 to 35-year-old, we say 2 to 3 sessions per year, 4 to 6 months apart. 35 to 50, 2 to 3 per year. Again, you can do it a little more frequently, but it's going to be a little bit shorter interval. And 50 and above, we're going to see that we're going to need to do a little bit closer together and maybe more sessions per year. Now, there are a few things. So this is the actual glass of protocol. You guys know that I talk about biostimulation a lot, and there are a few things that you can do to really improve your results with this, other than just what you mix in the product. And it's going to be really dependent on that patient selection and preparing them for this procedure. So if they're smokers, sun worshipers, poor diet, in the middle of their Ozempic weight loss journey or whatever that may be, you're going to kind of let them know that you're going to likely need more treatments, or you're not going to get as big of a result as our patients who are really doing everything to optimize that. So that's going to mean optimizing their lifestyle, their diet, and maybe even including some kind of supplement to support that collagen production. So, an over-the-counter supplement, something like a Juven or something you can retail in your practice, like one of the oral products, to really support what you're doing with our biostimulation. But this is the actual protocol, and what you'll see is from younger to older, you're going to need less treatments with our younger, more healthy lifestyle patients that will naturally produce more collagen with anything that we do. I love Paula Abdul. So I think, a lot of us, grew up with her, and we know her from many things. And this is a rock star treatment that she gets, and so she loves it for immediate lift with no downtime. And she gets this from Dr. Tess. So this is her quote, not mine. But it's interesting because I identify with this, because really what I saw as my rock star treatment was having Arash do this on a Thursday for me before we started a weekend seminar. So I looked great for the weekend to see all of you guys. And so in fact, as soon as we get off the webinar tonight, I brought mine home from the clinic today, and I'm going to go do one on myself. So this weekend in New York, any of you that are going to be there, you'll get to see the results of my treatment. So I actually love this, and I love the fact that Paula identified with this as well. All right, Arash, you want to tell them what we're doing here?
So yeah, this is like a little bit of demo on how we do it. And then she's one of the people who basically received Plexer, the glass lift.
Wow, it's just lifted. I look like I don't have kids, basically. I look like I get to sleep in till 10. This is amazing.
And she's an actress. She got 2 kids, one after the other.
So that was not so bad. I was nervous coming in because I've never done anything like this before, no treatments. And it was actually relaxing in some points. And, now I can walk out and do whatever I want. So that's exciting. I can't believe that this tiny, lightweight machine lifted so much. I would say 5 years. I can't wait to see the continued benefits over time.
Yep. And as you guys can see, I mean, she's absolutely gorgeous, regardless of what she had done. She was pretty to start with, and even looked better afterwards. And just to clarify, she is an actress, but she was not a paid actress for this. She actually got that is her own testimony. Like, she wasn't that's not a paid commercial. That is her testimony of her use of and her results from the Plexer. I see a couple of questions. People are asking about ZMN, Jeuveau. You can really use any of the neurotoxins that you use, and Arash answered that in the Q&A if you guys are looking at that. But what I'm seeing that I want to just give a little bit of clarity on from the physician standpoint is the dilution. I use a standard dilution, so I don't change the dilution a lot in my practice. Unless it's point of use. I don't want errors, so I kind of do things very standard. And so for this treatment, you will use your standard 2.5 milliliter dilution for 100 units of your Botox, ZMN, or Jeuveau. So for those, it's going to be 2.5 for 100 units. Now, in my practice, I use the on-label, again, approved reconstitution for Dysport, which is a product from Galderma. And for that, it's, obviously all of this is an off-label use of those products. So you can change the dilution however you want. But I've had good success with staying with the standard reconstitution rates. And so for Dysport, I use 1.5 milliliters. Okay. And then, I think the other ones, and then there's some direction to go to the Q&A box. You guys put them in the Q&A so we can capture those for sure and make sure that we get them all answered. So these are kind of coming up in the chat, and just while the video was showing, I wanted to make sure that we're kind of answering some of these as we go along. And then I guess we can go on back into the presentation from there. I believe that covers most of that. Okay, so for the glass lift, you'll see these are some recommended prices. Again, I recognize a lot of the names on this. So guys, I'm glad you're on here, and I look forward to seeing you in person soon. And so, I'm passionate about the business side of this, and we're developing a whole business academy with Empire. And so Arash has done a really great job of developing some pricing guidelines for you guys. But one of the key things is you're going to have to really look at your local market and see what it will support, because we can give you average prices, but we know that there are certain markets in the US that will support much, much higher prices than, what's average. And we know that there's some that it's going to be a little bit of trouble selling it, and you're going to have to kind of figure out how to price it and how to move it into there. I can tell you in my area, so I'm in North Florida, South Alabama region, And, some of our prices, it's harder to get that. But as soon as you start showing the results, that's all you have to do. They will pay these prices once they see the results. And so it's going to be really important for you to get your before and after gallery. Certainly some of these standardized photos that Arash has are really good for you to put out there in the beginning, but people will pay $1,500 to $2,000 per session if you can give them the results like I showed you on my patient, and like you can go on and see on the website with many other patients who have had it. Now, if you're trying to charge that price and you're going to skip on some of the products, so you choose to use some cheaper HA serum, or you're going to not give the full amount of toxin, you may have trouble charging some of these prices because the patients are going to want the results. And if you can show those results, you'll be able to get these prices without a problem. So your costs then, if you're sitting there and you're doing the math, you're going to see $1,500 to $2,000. And, it's going to cost you around $150 to $200 per treatment for you to, that's all your products included, your plexer tip, everything. So 150 to 200, you're going to price in the 15 to 2,000 range. The great thing about this, depending on, again, your state law, so I'm not a lawyer and I'm not going to tell you who you can delegate this to, but most places this can be done by other providers in your practice. You don't have to have the physician or NP do it. You're going to be able to delegate this in a lot of places. And so you're going to be able to do 2 of these per hour, which in my practice, if we're looking at who I would delegate some of the other procedures to, if we were doing microneedling, I would only be able to have them do maybe 1 of those per hour, because I have to count numbing time, and that's time in a chair. They have to get the numbing on, let it work, and then take it off and do the procedure. With this, there's no need for numbing. It's very well tolerated. Again, personal example, I'm the biggest baby and I can do this without numbing. And so as we get more into the ablative treatments, you will need some numbing, but for this one that we just talked about, the glass lift, you can do this no numbing. You can do 2 of these per hour easily. And so when you start calculating your ROI and how much you're making per hour in your practice, you'll see that this device is a game changer.
Hey. So this case, she is basically my wife, and I treated her face. She was like the first client who received a glass lift, and this is 2 months after first session. And you see, during these 2 months, she lost about 5 pounds. So even though she lost weight, she gains basically more collagen production. You can see more result here. Now, vector is a new idea, which basically this was from Dr. Croley, and we explored it together today. Yeah, here you go. Dr. Croley, you go ahead.
Okay. Yeah. So, this is just something that I had told Arash when we were talking about this. So, and it is an area where I've kind of, changed my thought process. So we've known for a while that the vectors are important, but they're actually incredibly important when we're doing the ablative treatments. So when we talk about vectors, it's basically designing a path or a vector, if you will, that is going to pull in the direction that we want this to pull to create a lift. And I think for those of you, again, watching, when we talk about vectors, probably the most common area that you're going to be familiar and you're going to be able to draw a correlation is when we design vectors for thread lifting. And so we always pull and tug on the skin and say, what will give us the best lift or repositioning of tissue that we're trying to accomplish with our PDO threads? And so we're very accustomed to doing it there. We're not so accustomed to doing that with our energy-based devices. We just think in general, let's just apply this energy, let's burn the fibroblast and let them all make collagen and elastin, and we will get an overall lifting and volumizing effect. And I think that's true to an extent, but what you're going to be able to find is if you apply this same concept or principle of vectors to what we're doing with our plexer, you're going to get even more results, because what we're doing is stimulating collagen and elastin in a particular pathway to really provide lift in the direction that we need it. So you'll see the first slide had some arrows for the cheeks. This one is going to show you the brows. And so what you'll notice with this is with a shower, we're doing our shower tip in this direction rather than just willy-nilly going all over the face in every direction. So we're trying to stimulate this in a specific vector to really create lifting in the desired direction.
If you guys are interested in glass lift, you can ask our office for the poster, and we can, ship you the poster. It's a good, basically, marketing base for you guys. So a little bit of ablative, Dr. Croley.
Yeah, so this is also a patient of ours from Skin and Tonic, and this is basically somebody's been a patient for a while and has that mole on her face that you guys can all see there that had bothered her for years. She had seen multiple surgeons about it, and they had offered her. She had it biopsied at some point, and it had been there for a long time, so they were not worried about any kind of malignancy or anything like that. And but they had only offered her surgical resection options. And so with that, she was concerned about the scarring that would leave on her face right above her lip. And, every one of them had talked about surgically cutting this out in some manner. And she had opted not to have it surgically cut out because she thought the scar would be worse than having the mole there. But it was something that bothered her to the point she said, I have to be very conscious and very aware when I'm taking photographs because I don't like being photographed from that side. I'm always turning. My kids, when I'm at their events, I don't want their friends to see me from that side. So always aware of how she was positioning herself to interact with people, to take photographs. So she also was pretty early on with my plexor experience. And I talked to you about this, Arash, and I'm like, she's probably a Fitzpatrick, 4. She's dark skin, dark eyes. The family is, they're from Portugal. They're Portuguese and actually Cuban mix. And so there's but darker skin type in general. And I was very worried about any kind of hyperpigmentation, especially the size of this. And you can see here, this is one treatment session, very quick treatment. And then you can see her quote there. That's actually a text that she sent me and gave me permission to use in presentations, because you see that it's something that she never dreamed would happen. It had given up hope of having it removed, and that she'll be, forever grateful. So it's one of those things, that's what we love to hear in aesthetics. So we can always freeze a wrinkle or a line and create some lift. But when you get these things where they're like, it changed my life, and she's like, now I'm so confident in photos. I just talked to her recently. She just returned from a trip to Portugal. She hadn't been home and to visit her dad's side of the family in over 20 years. And she was like, basically, because we did that. And of course we did some other plexor glass on her too before her trip. And she's like, I look better than all my cousins that I haven't seen in years. So the mole was a big thing for her. It was life-changing, but we did some other things that made her very happy as well. And that's always gratifying.
So I want to explain that this modality is basically the plexor soft surgery, is the ablative. So the last one, the glass lift, is based on nanoablative plexor, and then this is ablative. We also have another one which is semi-ablative, which is like a fractional lasers, but this is basically the ablative, which we call it soft surgery. In soft surgery, we removed unwanted or extra skin, and this is another example. Go ahead, Dr. Croley, please.
Yeah, so this is the one that we're talking about for the puffy eyes of blepharoplasty. And actually, some of you guys may know Dr. Triboni. He's one of our instructors in Empire. So I don't know if you've had classes with him. He teaches a lot in Georgia. Mostly he's outside the Atlanta area. And sometimes in Orlando, he joins us. But he's been with us for a while. And, Rosh, I'm assuming it's okay to tell a story, but it was funny because I've talked to him personally about this, but you share with me that he got the device and was a little bit concerned a month or two afterwards that he wasn't seeing results. And then you put his picture side by side and he's like, oh my God, like it's such a big difference. So what you'll find with some of the semi-ablative and any kind of biorejuvenation technique that you use, the results sometimes are not apparent until you show the photo because it's gradual. So there's very little downtime with it. You heal pretty quick and you almost think like, oh, did that do anything? Was it worth it? But then every day you're looking in the mirror and that's your new baseline. So you forget where you started. And this is something that you're going to see a couple of months down the road. Now, I've kind of seen that for many, many years in our practice with PRP. And it was to the point that I would say with PRP, like they're going to almost have buyer's remorse, think they're not going to have that result. And then they're going to be at a family reunion or some event 4 to 6 months down the road, and somebody's going to comment on how good they look. And they're going to remember, oh yeah, that is what I look like. So kind of the really amazing thing now is with the different technology, and especially with what we're talking about today, the plexer, we can see these results much, much sooner. So they're not having to wait, those 4 to 6 months. It will continue to improve. They will continue to see improvement up in that time frame, but they're going to get these results much sooner. This is going to be somewhere, maybe around even 6 weeks. They're going to start seeing some of these pretty drastic results. With the shower that we talked about, you're going to see it within a few days, some immediate result, and within a week, it's going to look great. For some of these, where we're trying to remove the puffiness under the eyes or really tighten that tissue, we are going to have to do this soft surgery, the semi-ablative, where we're actually getting rid of some of the excess tissue with the device. And so from that, then we have to heal. And so that is where we're going to go from no downtime, immediate results, go right about your event, to minimal downtime. So this is not like the aggressive CO2 lasers that we've all seen photos of, where you're having to keep your face wrapped up or covered up or in Aquaphor for weeks, but you're going to have somewhere around, depending on how much ablation you do, somewhere around 4 to 7 days, that you're going to have some marks on your face that you're going to, have to take care of, keep clean. And, we have some special products that you can put on to help cover that up. That's going to flake off. And then you're going to start to see the, tightening, and the real results start probably around, 3 to 4 weeks afterwards, and going to continue to improve for up to several months. But there will be noticeable results like this after one single treatment session within about 6 to 8 weeks. Would you agree with that, Arash? Is that about what
Absolutely,
you felt?
that's true. Yeah, that's true. And then also for the neck, I wanna move forward for basically this stuff, because we are kind of in 1 hour, and I really appreciate all the attendees, because it's like 160 people with us all this full hour, and that really encourages us to make better slides and better webinars. Next month we're going to have another one, which is going to be very interesting and educational, again with Dr. Croley. So thank you really for joining. You want to say about
and so next, I guess we can finish on this and then just kind of get to their questions. This is going to be a similar, technique to what we're talking about for the eyes. It's going to be semi-ablative. But you can see here really pretty amazing results, something that typically we would do combination therapies or send them out for surgery even. And so this is a soft surgery technique where we can ablate and treat some of the tissue to get those results. And with that, it's a pretty big ROI. So you're going to see with that, you could do 2,000 and up per session. If you can get results like that on the neck, I think you can probably even get more money, because people, in our area, neck lifts are now somewhere around $9,000 to $12,000 if you have a surgical neck lift. And so if you can get results like that with this device, you could probably even charge, more. So here we have 3,000 in that area. So you'll see there's a range, and you can base it on severity, based on your expertise, how many other people are doing it in the area. So there's multiple things that you can base that on. But really good ROI, because a procedure like this is going to take you less than an hour, and your cost on your actual disposables and your tips for the plexer is going to be, $20 or less. So it's not going to be a lot of money as your initial investment, but then your ongoing costs are pretty minimal.
Yeah. Okay, let's go to Q&As, Dr. Croley, and see.
Okay.
All right, I've kind of gone through and taken a look at some of the questions that I thought would be good to answer right away. I wanted to start off with the active feel. So we were talking about active feel, and what do you do with leftover active feel, and is there a shelf life for it? Should it be refrigerated?
So active feel doesn't need to be refrigerated. It is basically room temperature product. It's a very stable product. It's basically one of the best thing about it. And shelf life is 3 years. And each box contains 3 vials, and the active firm, each vial is 9 ml, so you have 27 ml in one box. And then active reverse is 3 vial of 5 ml, which is basically 15 ml per box. Both of them, they're $500 per box. And then your cost of each treatment when you use them is between $30 to $50. It depends on like if it is like the whole face or neck. If it is like small areas like around the eye, for example, after plexor blepharoplasty, then your cost is like $10 for each session. So it's not a big deal.
Yeah. And the only thing I want to add to that, so for sure, he's referring specifically to your Actifirm and Acti-Reverse. You will need to refrigerate it once you put the neurotoxin in it, because the neurotoxin will need to be refrigerated. So if you're doing the glass lift that we just talked about and we're adding the neurotoxin to that vial, then that will need to be refrigerated, and you can use that, for up to a couple of weeks after you mix that. It will be stable as long as it's refrigerated, and you'll be able to treat multiple patients out of that vial, because we're not injecting this. We're just sterilely getting it out and are aseptically removing it from the vial and putting it topically on the patient.
Yeah, thank you.
We've got another question here about allergy. Do you have any allergy risks or anything like that you consider when using Botox and Actifeel?
No, I don't have any. I mean, unless they've had some prior reaction to the neurotoxin, but no, none specifically, just for the neurotoxin and the Actifeel.
Right, great. Okay, there's a ton of questions that just poured in, so I'm going to try to select some as we don't have a lot of time here. Let's see. I'm going to just quickly answer. A lot of times in states, you need to check with your particular boards in your state or with a lawyer is the best way to understand what you can or cannot do in your state. Everyone is licensed differently. And in general, however, if you're an RN, you're looking at having physician oversight or some kind of collaborating physician for your practice. And that's just something you need to check with personally. Let's see. Let's talk about how many procedures can you do in a day? What are we talking about as far as turnover goes?
So,
yes.
Okay, Croley, can I say one interesting data? It will be very interesting for you. One of the doctors that is working with me for the past 7 years, I was talking to him. He will be basically the Plexor ambassador in Paris in the upcoming IMCAS, basically in few days. He has done 13,500 plexor operation for the past 7 years, and his basically high rank was 23 plexor operation each day, and the minimum that he does is like 6 operations. And he has stopped all his practice, everything. He doesn't do even Botox injection, anything. He just does plexor, and then he says that I just do neck, face, and hand. It's basically it's a very interesting way of using plexor, but you go ahead now.
No, I mean, I think that's very interesting as well. So I was looking at the questions. I don't know, was there one that I missed, John? But I mean, the one that stood out to me was about basically doing any kind of vectors on the neck, any kind of planes.
Right.
We do an upward vector on the neck. I like to do actually a diagonal approach when I'm doing that. So because we're wanting to lift up. Using the instrument without the neurotoxin in the serum, yes, you can use this. Absolutely, you can. So we went over, the topic of this was to go over 3 of my favorite lifting techniques, and so we were going to do the glass lift, the puffy eye, or the eyebrow lift, and the neck lift. Those were the 3 we picked. But you can absolutely use this in your practice with other types of serum, because it's it's going to create nano channels for you to have your active ingredients more readily absorbed.
Would you use this with any Fitzpatrick scale skin type?
You can. You need to. You can use it absolutely with any Fitzpatrick skin score. Obviously, we are going to probably do some different settings. So as with anything, when you get it, you are provided training. So that's one of the good parts about it, that you will get training with the device. And in that, we teach you the protocols to use it on all skin types.
Yeah, absolutely.
Okay, great. And then I asked another question about the frequency, like how often you can do it, or within a day, for instance, for your practice. I got a lot of questions about people who are new within aesthetic practice, and if this is what they can expect to produce in their practice using it regularly.
So again, it's going to depend on kind of your setup. So in my practice, we can do 2 of the glass lifts per hour. but you're going to have somebody, that's an assistant that's going to help you check them in, process them, etc. So it depends if you're open 6 hours, 8 hours, 10 hours per day. But with that, you can roughly do 2 per hour for some of the, like if you do a neck, a fully, like a ablative, we're going to do a neck lift with it. It's probably going to take you, once you get experience with using the device, maybe somewhere around 45 minutes to do that. For eyes, you're going to be able to do those very quickly. For moles, you're going to be able to do those very quickly. So I think a number per hour is not really an accurate measurement, because it's going to depend on the procedure. And then our number per day is not accurate. It's going to depend on the procedure and how many hours you're open.
Okay, great. And then let's see, somebody else asked a question about Botox injections and how long you might wait afterwards before doing a procedure like this.
If I was going to do a procedure like this, I usually do this first, and then you can inject the Botox right immediately at the same time. And so if I'm going to time them in the same day, I usually do this first. And like anything else that I combine with Botox, I do the injections at the end afterwards in the muscle. But you can inject through this that you're going to do topically. If I was going to space it apart, again, there's no reason if you do your Botox not to, the next day do this if you wanted to.
Great. We do have a lot of questions in general, so I do want to let everyone know that we will be answering all of the questions. So if your question did not get answered, we will send out an email recap that has the video recording along with the questions and answers to all of them. So if you didn't have your question answered, I know it's really tough. We could spend the entire session just doing a question and answer, which we might do as one of the webinars. So, stay tuned for that one.